So I did a facelift yesterday, and I was thinking maybe we should talk about the modern facelift.
It's a good topic.
The traditional facelift, the one in which I was trained, was developed about 30 or 40 years ago, and it, for those of you watching on YouTube, it takes the face and it pulls it obliquely, kind of backwards and sideways.
That windswept look.
And yeah, it can lead to a windswept look, and it takes the neck skin and puts it behind the ear.
Right.
Usually what is kind of an ugly incision behind the ear. And if you ask your hairdresser, any hairdresser will know that they see these big incisions behind the ear.
And usually most people who have them are probably over the age of 50.
Right. And that's the way I was trained, and it leaves a nice result, but it's not particularly natural. And
it's not anatomically correct.
Correct, because the neck skin never was behind the ear.
Right.
It comes from above. And the modern facelift, which was developed originally in Brazil and then modified in Belgium and now modified here in the United States, pulls straight upwards, which is a more natural thing because skin falls. Gravity works on our skin and connective tissues, and to pull it sideways is a bit unnatural. To put it back, restoring it where it was before, is much more natural. And other terms that are used for it are the S-lift, that's one of the old versions of it, or some
I remember
people...
that from your residency tests that I used to help you study for.
Okay. Some people call it the minimal incision facelift because it's a smaller incision, because it doesn't go behind the ear.
Where is the incision?
The incision starts, that's a good question, thank you. The incision starts in the hairline at around the temple. And this is what's interesting. The traditional facelift puts an incision right at the hairline, and if you look carefully you can see it. This puts the incision back behind the hairline, and it's beveled, for those of you seeing on YouTube. It's beveled, and that preserves hair bulbs underneath the scar. So as the hairs grow back, they go back through the scar and they help hide the incision. As it goes down, everybody's got a natural crease right in front of the ear, and then in women it goes behind that triangle that everybody has. It's called the tragus. Yes, it's called the tragus.
Okay, tragus.
And then it ends right at the bottom of the earlobe. It doesn't go behind.
So you're cutting into the only obvious place then is above the little tragus and at the earlobe.
Yeah, and it's not that obvious because everybody's got a natural crease right there. So it just fits naturally into that fold. In men, it's usually not a good idea to go behind the tragus because that pulls hair-bearing skin right onto the tragus, and you don't want the beard right on the triangle part. Okay. So
you could laser it off.
Correct, but it's a very sensitive area.
All right.
It's usually better in men just to.
I've given birth, so you know what? Nothing compares. Sensitive, schmensitive.
Okay. And then. So that's about the skin part. Another difference, a very important difference.
This is a full facelift you're talking about.
Yes.
Top of the head to the chin.
Not top of the head. That involves doing a brow lift and an upper blepharoplasty, an upper eyelid tuck. We'll talk about that in a second.
Okay.
But what I'm talking about is sort of the standard facelift, which covers the cheek, the jowls, the neck, because I really believe that from the lower eyelid all the way to the neck is one anatomical unit, and I think it's a little strange to separate them out in different pieces. There are some people who will benefit for specific parts, but
and there are other surgeons who will argue with this respectfully. I mean, this is just his way of doing it.
This is just my opinion. I think it's all one unit, and so when I do a facelift, I always do a neck lift. I do neck liposuction. Even if there's not much fat in the neck, it's just to loosen the neck skin so that when I pull upwards, it comes up. So I always include the neck, the jowls, the cheek, and when you lift straight up, you always get a wrinkle under your eye, so I include a lower eyelid tuck. It's all part of the same procedure.
Yeah, you know what? With my cheeks that you've been filling up, I keep telling you the Botox isn't working. I still think it's not working, but I think it's also because my cheeks are so filled up that I'm forcing wrinkles on my skin.
That's a good point.
Yeah, okay. Just a side note. Okay.
So the second important issue is what do you do with the underlying tissues of the face? No facelift is going to last if you don't lift the underlying connective tissues, which it's called the SMAS, S-M-A-S.
I remember that too.
Okay, subcutaneous musculoaponeurotic system. And the cheap and quick facelifts don't lift up the SMAS. They lift up the skin.
Lift
We won't talk-
Lifestyle lift, right, okay.
There are
I
many
can
different
see that.
names,
Okay,
right?
yeah.
Many different names and
They're advertising on
way to
TV
do it.
now. I'm
But
70
you
years old.
have to
Sorry.
lift the underlying tissues, this mass. And the traditional facelift cuts through this mass, makes an incision through this mass, and dissects underneath it. And that's where all the blood vessels and the facial nerves are. And that can lead to significant swelling and some complications. What I do, the modern facelift, takes a suture and weaves it through this mass. It pleats it. So you're not cutting underneath it, you're not dissecting underneath it. It holds it up as long as a regular mass lift for about 10 years, and it avoids a lot of the swelling and bruising, and you never get a facial nerve injury.
That's excellent. You know,
And-
it's funny, I just want to interrupt and say something nice about you. I've spoken to some of his patients who have had these modern facelifts of him. He never messes one up. And they're out, which they shouldn't be, but these crazy women are out driving a couple of days later because they feel great and they look good.
Right. Most of my patients can drive to their first visit at about a week later.
Yeah.
You know, I don't recommend it because you need to make emergency maneuvers, especially in New Mexico.
Right. That's right.
But the point is, by doing it this way, there's less bruising, less swelling. You add on the integrative team that I have,
Oh,
the
yeah.
acupuncture, the reflexology, the holistic medical aesthetics. That really makes it a very comfortable and much easier operation than the traditional facelift.
Yeah, I'm looking forward to trying one of these years because it ain't no thing anymore.
Right. Another thing I like to do is spin down the patient's blood during the operation, and I
that's very
extract
fancy.
all the wound healing molecules from it, and I spray them back in.
That's very high tech.
That helps jumpstart wound healing. And for example, the traditional facelift requires a drain. I don't need a drain.
No.
So anyway, that's
very
the skinny
interesting.
on the traditional, on the modern facelift. There's
Right.
more information on my website. You obviously can come in.
And nothing wrong with the traditional, but this is what Dr. Ronel has turned his into.
That's what I like to do.
Right,
Yes.
that's what his specialty.
So anyway, thanks for listening.
And Merry Christmas!
Merry
Greetings of the
Christmas, happy
seasons
holidays.
to everybody. And Happy New Year. But we'll
Yes.
speak to you, I think, before the New Year.
Okay, and come back next week.
All right.
Thanks.